Good morning, everyone. My name is Mark Mormon, Senior Vice President of Entrepreneurship and Venture Development at the Arizona Commerce Authority. I'm excited to be presenting this morning's session of the Arizona Small Business Bootcamp. First, I want to thank our community partners across the state. We couldn't be putting on this bootcamp without their support, and we're very proud to be working with all of the community members on the screen and many, many more who are helping deliver amazing content on a day-to-day basis. The Arizona Small Business Bootcamp and Resource Collective is meant to help businesses of 20 employees or less sort of navigate and respond to the COVID crisis in order to return stronger now that the economy is reopening. It's a statewide initiative supported by those community partners that I mentioned on the previous page, and it's going to be running through June. It was originally going to be 6 weeks, but the content has been so great and the impact so strong that we're excited to continue this throughout the next month. There's also a resource collective where we're compiling and aggregating resources from all of our partners on our website, which I'll link to in the chat box, where you can see all of the resources and great work available to you from those partners. This week, we've got some great topics. Yesterday, we had a fantastic session on navigating new guidance around PPP forgiveness. If you missed that, you can watch the recording on our site, which I'll link to, and we will also be doing another session on PPP forgiveness next week, if you have further questions about that topic. Today, we've got Dan Bogart from the Arizona Restaurant Association talking about reopening your restaurant. Thursdays are our safety days with the National Safety Council and the Arizona chapter talking about best practices for safety. And on Friday, we have a session on marketing to return stronger to help you and your business brand and market for their return. We've got some quick updates on the PPP process. Robert, if you want to share some of those.
Yes, good morning, everybody. Appreciate it. On the updates, there's no big changes today from yesterday. We are still sitting at around 110, 114 billion in the PPP pool from what the SBA is sharing each day. They're combining rounds 1 and 2 now, showing the total numbers. The exciting thing is with between the EIDL and the PPP, Arizona has received over $9 billion in funding to help Arizona small businesses. So that's the real exciting number there, that Arizona is seeing the numbers, and we are doing well as a state in those funds. So thank you, Mark.
Great, thanks, Robert. So in addition to the Small Business Bootcamp, there's a number of other resources that we're excited to share. One is with the SBDC. They've got business coaching and consulting, contacts with lenders, and just a ton of resources for small business owners. So I encourage you to check out your local chapter. We've also launched the Arizona at Work program, which helps with recertification, training, and job seeking to get our workforce back at work. And finally, if you're manufacturing, we've got the Arizona MEP program, which provides consulting and additional resources for some of Arizona's manufacturers. I'd also encourage you to check out the Arizona Together website, which is arizonatogether.org. The governor's office put this together to compile resources for individuals and small businesses navigating the COVID-19 crisis. On that site, as well as on the ACA site, we've compiled a number of the leading guides for restaurants, hoteliers, retailers, cosmetologists. As people look at getting back to work, there's lots of kind of best practices, tips, and resource guides on how best to do that. So we've listed some of them here. We encourage you to check them out at our website. And speaking of our site, azcommerce.com/COVID-19 has all the latest news, status, and updates regarding business resources and direction and guidance given the COVID-19 crisis. Today, I'm very proud to be introducing Dan Bogart from the Arizona Restaurant Association. He is their Chief Operating Officer and has a ton of great experience and guidance on how to think about reopening as a restaurant. So without further ado, I will hand it over to Dan. I will hand you my screen as well, if you want to throw your information up there. And as he's doing that, we'll have plenty of time for Q&A after the session. So if you have questions throughout, you can put them in the Q&A tool at the bottom of your screen or in the chat box. And I'll be sending over some links in the meantime for you to find some additional resources as well. So Dan, I hand it over to you.
Thanks, Mark. And can you see my screen?
Yes.
Okay, perfect. Well, thank you. Good morning, everybody. Again, my name is Dan Bogart, and I'm with the Arizona Restaurant Association. And today I want to talk to you a little bit about some of the reopening resources that we have for restaurants out there. So really there's kind of a couple of objectives here. One, we want to make sure everyone understands what the legal requirements are. And then above and beyond that, kind of what the industry best practices are that we've put together. And then let's look at what some of the additional steps restaurants can take and that the association's taking to help restaurants try to make it through the summer as we're go into our reopening. So we'll do the presentation and then we'll open it up for Q&A afterwards. And I think Mark will probably walk you through how that will work. So how did we get here? Well, first thing is, it's been about 2 months, almost 2 months, since restaurants were originally shut down for dine-in service, going all the way back to March 19th. Since then, we've seen a series of steps. And I won't go through all of these, but I think the key ones are the very quick pivot to takeout. So the governor issued his executive order on March 19th, basically saying restaurant dining rooms are going to need to be shut down. And very quickly, we were able to launch the Arizona Takeout Weeks program on the same day to encourage consumers to continue patronizing their favorite businesses. We were able to secure a very major victory by having restaurant-to-go services listed as essential. And that was key because 7 days later, the stay home, stay healthy, stay connected order went into place. But by having us listed as essential, restaurant workers were able to continue to commute and go to work, and individuals are able to continue to access our services as essential. Then on May 4th, we got the exciting news that restaurant dining rooms are going to be able to reopen on May 11th with certain restrictions. And on May 11th, we did see a number of restaurants start to reopen, and that number has been growing every week after that order has gone into effect. So let's talk about what are the legal requirements. The actual language from Governor Ducey's executive order reopening restaurants is there on the screen. And it's essential that we kind of read this in context. So what he's saying is that restaurant dining rooms are able to reopen provided you basically put into place the protocols and practices as recommended by CDC, OSHA, and Arizona Department of Health Services. And so there's really 3 agencies there that we need to make sure we're taking a look at. And CDC has guidance related to masks, physical distancing, employees. OSHA has additional guidance on employees, and Arizona Department of Health Services has guidance on multiple topics. And so we'll hit on each of those real quick. So what does the CDC say? Well, the CDC has a couple of documents out there that we really need to kind of go and look and browse through. They have one that's specific to restaurant operations for to-go and delivery operations, and they also have other guidance that's related to retail food establishments. So that's more than just restaurants, but includes us as well. So really they're looking for a couple of things here. I won't hit all of these, but just some of the big ones. The ability to protect employees at higher risk. So if you have somebody who might be severely asthmatic, you might want to look at trying to put them into a task that does not have as much contact with the customers or other employees. Healthy hygiene, including wearing cloth face masks, and that one's key as we start getting into the ACDH guidance. There's a lot of questions out there. Are restaurant employees required to wear masks? And we'll get into that a little bit more in depth later on. And of course, the next big one there is social distancing. So that's 6 foot of separation. I think everyone's pretty aware that as we open our dining rooms, we're going to have to keep groups of patrons at least 6 feet apart. And then, of course, wellness checks for employees. And again, we'll talk about that a little bit more in depth later on. What does OSHA say? OSHA has many intersections here with COVID-19 response, including what's basically allowable for OSHA regulated entities, documentation requirements, et cetera. But here I just want to focus on what they suggest for employee safety. And a lot of this is going to be very similar to what we see in the CDC. So encourage workers to stay home when they're sick, avoid any direct handoff when possible. That's a little bit more specific to takeout and to-go ordering. And then here's the next one is training workers in proper hygiene practices. Now, a lot of this is taken care of when our workers are going and getting their food handler's card. But I think what OSHA is really looking for here is for you to institute some sort of your own training plan in-house. It doesn't have to be hours long, but something maybe before each shift you go over 5 minutes on what the practices are, how many times servers should be washing their hands, et cetera, on what your own internal protocols are going to be. Everything else makes a lot of sense. Provide a place to wash hands. All restaurants have that. That's part of the food code. And then the next one is encourage workers to report any safety and health concerns. So what we want to do is try to help create an open line of communication between our employees and our operators and see if we can find solutions to any of the concerns that they have. The Arizona Department of Health Services has 2 relevant documents here for us. The first one was released along with the governor's executive order a few weeks ago, and it's titled Guidance for Restaurants Providing Dine-In Service. And there's a lot more on this list, but I just wanted to hit a couple on this slide. So again, this goes back to assigning duties to vulnerable workers to minimize their contact. That comes directly from that CDC recommendation that we were looking at before. Enforced hand washing, covering coughs and sneezes. Again, that goes back to both the CDC and the OSHA guidance. The next big one, I think, is the use of cloth masks for employees when near other employees or customers. So this is where that question of are restaurant employees required to wear masks or not comes in. And really, it comes down to do you have an employee that will be in contact with individuals within the 6 feet, right? So if you have an employee, for whatever reason, they're not going to be in contact with somebody that is within 6 feet of them, that's probably when the exemption of not having to wear a mask comes in. But other than that, all of the guidance we have, CDC, OSHA, Arizona Department of Health Services says they should be wearing a mask when they're within the 6 feet of either customers or other employees. Posting signs on how to stop the spread of COVID-19. We see this already in restaurants. Many places put them up even when they were in delivery operations. Most of the time you can find these. If you don't have one, you can find them on your county health department's website, and very easy to print off and post up. And then, of course, the wash, rinse, and sanitize food contact services, preparation services, and beverage equipment after each use. And then the next big thing there is going to be using menus that are not easily contaminated. So, for instance, this can be something as simple as a disposable menu. It can be an app-based system where customers can pull up their menu on their apps. We've seen restaurants use menu boards, et cetera. And we'll talk about some of the options here later on. The one other thing I want to highlight on the AZDHS's guidance is they do specifically say that restaurants should be implementing symptom screenings for employees, and that is in line with CDC and guidance as well. The other document that Arizona Department of Health Services has just recently released is they put out a frequently asked questions document. And it's our understanding that they're going to continue adding to this. So as that happens, the Restaurant Association will continue to keep everybody updated. But a couple of big things that came out from their most recent release late last week was they did identify that local police are going to be responsible for any type of enforcement. So if a complaint comes in about a restaurant not following these procedures, it's not going to go through the health department, it's going to go through the local police department, is how that will work. It reiterates the need for cloth masks by employees, and it does clarify that restaurants should discontinue self-service buffets, salad bars, and beverage stations. So that was one that was very much in the gray area prior to them issuing that FAQ document. And then, of course, disinfect customer areas after each sitting, and we'll get a little bit more into that later on. One other agency I want to talk to you about that has a lot of interplay in this is the EEOC. And that's because they're responsible for enforcing the Americans with Disability Act, especially when it comes to employees. So they basically put out some guidance on what is allowable in this new COVID-19 realm that otherwise would have been a little bit questionable under the ADA. And so it's important that they've given us some guidance here. Specifically, they've talked about how temperature checks that employers may measure their employees' body temperatures, specifically to screen for symptoms of COVID-19, and that employers may require their employees with symptoms of COVID to stay home. The other big thing here is doctor's notes. They've stated that employers may require a doctor's note before an employee returns to work, although they caution, and I would echo this, that many doctor's offices are still not set up to take in-person visits, and so the employer should be aware of the ability of their employees to access that type of documentation. So now let's talk about what kind of the industry best practices are. And really what the Arizona Restaurant Association did is we put together a document called Welcome Back to the Table. And we worked with industry professionals, public health experts, restaurant operators, and our supply partners to figure out what's going to be the best way to bring customers back to our dining rooms in a safe and responsible way, but also one that our supply chain is able to support. And that's why I think it was very important that we have the suppliers in on that conversation. So we really broke it down in a couple of sections. Guidance when preparing to reopen. So if you've not completely reopened your dining room, there are some items in there that you're going to want to take a look at. Rehiring staff, restaurant reopening responsibility and options. And that's where we kind of go in and break down each of those areas where we're talking about social distancing, employee practice, sanitation. And then of course we try to address the bars and bar areas within restaurants, because that I know that's been a concern of a lot of people. And we provided some additional resources in that document. And that document is available on our website and also the ACA's website as well. So what I did here is just try to break down a couple of things. So when we're preparing to reopen, there's a couple of things we want to do. We want to make sure that we're doing everything that's in compliance with the food code, and this is something that the county would be enforcing. But we want to make sure that, for instance, all of our equipment is working. So cold holding and hot holding equipment, are they holding or providing enough heat or coolant to that equipment to keep them above or below the time for temperature control for safety? We also want to make sure that all of our areas are clean. Some of this equipment hasn't been used for a while. Some of the food prep area hasn't been used for a while. And it's easy for that to accumulate dust and other contaminants. So those are things that we want to make sure that restaurants are doing before they're fully opening their doors. Rehiring staff. You know, it's interesting that if you look just 2 months ago, I don't think anyone could have imagined the complexities that would come into trying to bring your staff back to work. But it really has come out that way. So rehiring staff really is a critical part of reopening a restaurant. And we want to make sure the guidance we put out for restaurants to do this is making sure that they're doing it in a smart way that protects both them, their employees, and helps them for any type of PPP compliance. So what our suggestions are to make all offers to return to work in writing, and in that letter outline the new policies and procedures put in place to create a safe workplace. We also want to include some basic information. So what I tell a lot of restaurateurs is pretend like this is an initial offer almost. Even though it might be an employee that you've had for a long time, nothing's changing, we still want to see that information included, such as job location, rate of pay, job duties, and schedules. And then the next thing is we want to keep written records of any job acceptance or denial. And that's because under the PPP guidance, if you've made a good faith effort to bring one of your employees back on and they've denied that, you can still get credit for that employee when it comes to your forgiveness calculation. And so that's one of the main reasons we want to make sure we have all of our documentation in order. Social distancing, I think most restaurateurs are going to be very familiar with this, but we need to limit our party size to 10. Everyone else needs to be separated by at least 6 feet in all directions. So I think the important thing there is it's not talking about tables separated by 6 feet. It's once individuals are seated, those individuals need to be separated from other members of other parties by at least 6 feet in all directions. Now, as an alternative to this, restaurants do have an option to put up protective barriers, and we've seen this implemented in some restaurants so far, especially ones that have booths, where they put up a protective barrier on each side of the booth, and therefore you basically have a physical barrier, and you eliminate that need to separate the parties by at least 6 feet because they have those physical barriers between them. The next big concern, we've seen this in several cities and counties that have commented that they have some concerns about it, and that's our waiting areas. So people who are trying to wait in the restaurant or trying to wait outside of the restaurant should try to do everything they can to make sure that if anyone's waiting, those parties are still separated by 6 feet. We are highly encouraging restaurants to use technology solutions, such as having someone put their name down on the list. They can go wait in their car, get a text message when their table's ready, or perhaps be able to walk a little bit further away from the restaurant to create that physical distancing. Employees. we think it's going to be very critical for restaurants to have a robust employee health screening protocol in place, and that would include temperature checks. And I think there's multiple ways to do this. So for instance, we've all seen the contactless thermometers that are used, where you can take someone's temperature from a little bit further back. The important thing there is when you're doing that, keep in mind, make sure you're reading the thermometer's directions. Many of the contactless thermometers require that the individual be in the environment they're being tested for about 5 to 10 minutes so that their body temperature can acclimate. That's going to be incredibly important here in Arizona when we might have employees coming inside our restaurant from 115-degree heat. They're going to need some time to acclimate. So having a protocol for how that happens is going to be key. And then, of course, what the other thing we want to do is make sure that when we're recording that information, we're not taking down anything that could be considered a medical record. So what we're suggesting to all of our restaurants is, as you are recording as you're taking their temperature, what you want to do is have a series of questions asking about COVID-19 symptoms and their temperature. You don't want to write down what their answers were to any of that. What you want to write down is, did they pass or did they fail? Right? And so that way we're not recording any type of medical information that would fall under the HIPAA laws. Again, we do think it's important that staff are wearing cloth masks, especially when they are within 6 feet of each other. And an important thing there is if you're going to utilize cloth masks, they do need to be laundered after each use. Now, it's completely up to the restaurant and how they want to do that. If the restaurants, for instance, want to own the masks, they might be able to work with their linen providers and have those washed after each shift, et cetera. Or if it is the employee's responsibility, we just need to make sure that we're verifying that had been laundered after each use. And of course, enhanced hand washing scheduled for front of the house staff, and just have your kitchen staff continue to follow the food code rules. They're already very good at preventing the transmission of communicable diseases. I think what's important in the front of the house staff is we've seen a lot of consumers who have commented that they want to see their servers wearing gloves as well. And the one thing that we would caution on is if you're going to put your servers in gloves instead of on an enhanced hand washing schedule, you need to have a glove use policy, because gloves are really only useful if they're used for one task and then discarded, hands washed, and donning a new pair of gloves. Otherwise, it's actually a more dangerous environment that we're creating by having those people continuously wearing the same pair of gloves. It's actually going to be a lot safer to put them on, let's say, washing their hands every 5 to 10 minutes would be safer than having them continuously wear gloves. Sanitation. So most restaurants already have a very robust sanitation protocol in place. The food code for years has basically been harping this into all of our operators. But there's a couple of things I think we want to look at that we can change specific to COVID. And one of those is going to be looking at alternatives to traditional menus. So some of the ideas that are out there, you can use menu boards, single-use menus, app-based menus. Some people are considering just putting some flat-screen TVs throughout their restaurants that have scrolling menus. The other option is you can use a reusable menu. We just want to make sure that it's easily sanitized after each use. So what we've seen some restaurants do is they've taken their traditional menu, they've put it onto a legal size piece of paper and fully laminated it so that laminated menu can very quickly be sanitized and put back into use. We've seen other people who have gone to the single-use menus as well. But this industry is resilient. I'm sure we'll have a couple more ideas here for you in the near future. The next important thing, and this does come from ACDH guidance and CDC guidance, is the customer areas have to be sanitized after each use. So we're talking about tables and booths. If you're using tablecloths, those are going to need to switched out for a freshly laundered tablecloth. Chairs, booths, and anything else that the customer was likely to come in contact with during that seating. And it's important, I just want to harp on this a little bit. It is important that we're talking about sanitizing and not necessarily cleaning the customer area. So we want to make sure that whatever chemicals we're using, we're following that direction and making sure that the contact time with all those surfaces is adequate enough to kill it. And then, of course, increased cleaning and sanitation schedule for commonly touched surfaces. These are going to be things like door handles, countertops, or anything else that people are likely to touch just in the normal operation of the restaurant. Bar and bar areas. So there's been a lot of talk about the bar and bar areas. What I can tell you is the way that the governor's guidance is written and all of the other guidance that's come out of CDC and DHS is there's not a huge difference between bar areas, bars, and a traditional restaurant dining room. What we are seeing, though, is that we're going to need to make a couple of other minor adjustments in those bars. For instance, most bars are used to having multiple prep areas throughout along the entire bar itself, where whether we're mixing drinks, pouring a beer, or prepping someone's food that just came out of the kitchen to give to them. What we want to do for that instance is create a section of the bar that's dedicated strictly to that prep work. So any drinks that are being mixed, any limes that are being cut, anything like that is done in one area, and that we're not allowing customers to sit within 6 feet of that area. And additionally, the bars, just like everything else, we're going to need to make sure that groups of people who are choosing to dine together are separated at least 6 feet from each other in all directions. And in many bars and bar areas within restaurants, they have standing areas. What we're suggesting restaurants is they designate seating and standing areas in the bar area and limit congregation to those areas. What we don't want to see is a whole bunch of groups in the bar area that are now having to intermingle with other groups to get to the bar and order a drink. So we want to make sure that that's set up in such a way that that does not happen. Next thing I want to talk to you about is customer confidence. Now, we did a consumer survey before restaurants reopened. And one of the big things that we got out of that is customers really want to see and feel the safety protocols. So the more restaurants can do as far as being visible in their sanitation and other prevention measures, you're going to put your customer base at a little bit more ease. The other thing that's going to be key to this is education. Customers have preconceived notions on what they think is safe, and sometimes that is in conflict with what restaurants need to do to actually keep them safe. And a perfect example of that is glove usage on front of the house staff. We know that there's a section of the population out there that wants to see all of their servers wearing gloves. And I think that once that education takes place, talking about how it's actually safer for us not to be wearing gloves, but to be washing our hands, those customers get put at ease, and now they're able to amplify that message to their friends and family. So I think education on all of the things that we're doing to keep our customers and our staff safe is going to be key. And customers are going to be wanting to be involved in that conversation. You know, they're going to ask questions, they're going to have questions, and they're going to have these preconceived notions. So I would just prepare your management staff and your frontline staff to be able to handle some of those questions as they come out. So what's next? Well, you know, as we all have learned in the COVID-19 era, everything changes hour to hour, minute to minute. But a couple of things that we're working on right now is we have a limited number of people we can put in our restaurants because we have to comply with that 6-foot distance. So what about extending our premises? And so we've been working with the state, counties, and cities to try to come up with plans for restaurants to be able to do this in an organized but quick fashion. Now, for anybody who might be situated in areas such as Maricopa County, Pima County, and Pinal County, the extension of premises is probably going to be a little bit less useful during these summer months, but we definitely want to make sure that those are in place so that as the weather starts to cool down as we enter the fall, we're able to utilize those mechanisms. And similarly for restaurants that are located in cooler environments, you know, maybe up north, being able to utilize those during the summer months as well before the cold weather comes in and makes those a little bit less useful. Next thing, technology solutions. We already talked about some text apps for waiting lists. We've also seen some great solutions out there for app-based wellness checks that do temperature verification so that restaurants are able to do that, have their employees do their own wellness checks before they even arrive on location. And so that definitely helps cut down on touch points. And we're going to continue to see those types of solutions come on board. And not necessarily technology solutions, but another thought is physical solutions. So we've seen several companies that have come up with very unique ways for restaurants to add physical barriers into their dining rooms so that they're not having to decrease their overall capacity. And so those things are going to continue to come online. We would just suggest that everyone keep their ear to the ground and see what works for you and your individual concept. Just want to highlight a couple of things. Our back to the table restaurant guidance is available on our website. I did put a link in here for that. We will continuously be updating that as DHS issues new frequently asked questions or there's changes in CDC guidance, et cetera. So just keep watching for any type of updates that are coming out on that guidance. I also wanted to point out a couple of other things that might be useful for restaurants and their employees. The Arizona Restaurant Strong Employee Relief Fund is still going. This is a fund that provides $500 grants to displaced restaurant workers. We know that we're reopening our dining rooms, but we're still not able to bring everybody back, and so we want to make sure that we're there for our employees as well. And so if you have employees that are still displaced and you haven't been able to bring back, this is a good resource for them. The next thing is ServeSafe, which does our food handler and food manager training, has launched 3 separate courses that are all free for restaurant operators and their employees that deal specifically with COVID-19 safety measures. And those 3 courses are dealing with delivery, takeout, and of course dining room operations in the world of COVID-19. And as always, the Restaurant Association maintains a COVID-19 resource page, and on there's an opportunity to sign up for updates or ask questions. And what we do is if we can't answer those questions ourselves, they're bundled in and they go up to the various agencies for us to try to get answers to them. And we've seen some pretty fast turnarounds on that. So that is all I have for the group today, and I'm happy to answer any questions that I can.
Thank you so much, Dan. We do have a few questions that have come in. And again, if you do have more questions, feel free to type them in the Q&A box or the chat box. One that's here is, has there been any standardized process adopted by which the CDC and Department of Health are coordinating on an effort to streamline the process for making it easier so the restaurant industry can have the ability to know that their efforts have aided in their COVID-19 compliance? Is government or the restaurant owner burdening the added cost to achieve COVID-19 eatery compliance? And that's a lot of text, so if you want to read it, you can just click on that Q&A button at the bottom of your screen, Dan.
Yeah, let me see if I can get over there real quick.
And in the meantime, while he's looking at that, we have a question about, can we have this presentation? So this recording will go on our website with the slides shared. I'll reshare that link with you, but that'll be up in just a few hours.
So I think I get what the question is getting at. The CDC and the Arizona Department of Health Services are coordinating. They generally have calls. They're constantly sharing information with each other. As far as, are they doing something that's going to streamline a process to specifically get metrics that show that restaurant efforts are helping to decrease COVID-19 transmissions? I don't specifically know that answer. I do know it would be very difficult. We're not the only industry that's been opened back up. And so I think really what they would be looking at is the mitigation measures overall in the entire economy. How are those working for our numbers? We know this, that the governor is going to continue looking at our infection rates and what our overall numbers are for moving us forward into phase 2 and phase 3 of the reopening. We are in phase 1 right now. So those are the types of metrics they're going to be looking at. I hope I answered your question, but if not, maybe we can talk offline as well.
Great, thanks, Dan. Is there a template for the return to work letter to employees?
Not a specific template. I think that in our document, we talk about the information that should be in there. Again, every restaurant's a little bit different in their operations and their structure. So we just want to provide the information that we think should be included, but I don't necessarily have an exact template for you just to plug in, like, for instance, your logo onto. But all of the information is in that document as well on our website.
Thanks, Dan. And while you're chatting, I am also going to, I know it was in slide form, so I'm pasting all those links from that last slide into the chat box. So the welcome back to Perfect. The table guidance, the Restaurant Strong Employee Relief Fund, the free courses, and the COVID-19 page are all linked in the chat box now.
Fantastic. Thank you, Mark.
Do you have any special recommendations for family-oriented restaurants? Our typical party includes at least 2 to 3 kids.
I'm sorry, Mark, I missed the first part of that. Can you say that one more time?
I guess there's restaurants that you know of or that have started to reopen. I think in this time it's hard if you have kids. I know for pool guidance, there's a lot around kind of kids running around, and so I'm wondering if there's restaurants that are more family oriented that have begun to reopen.
Yeah, absolutely. We have seen that family oriented restaurants reopening. I think it's the same type of guidance. We want to make sure that we're set up in an environment that we're keeping everybody separated. You know, some of the concerns might be, as you pointed out, Mark, are the kids running around and kind of penetrating that 6-foot separation. I think really that comes down back to the education part. So if you see that activity taking place, it's really just going to be an educational conversation you're going to have with those parents, saying, hey, listen, we're trying to keep everybody safe in our restaurant, and we just need you to make sure that you're keeping your children in the same area, in your designated area.
And have you seen sort of, do you have any success stories? So we talk a lot about kind of all these changes, things like that. Have you seen any restaurants really adapt quickly or really embrace the takeout model or move to a kind of an online experience for orders or things like that? I think it might be helpful to kind of share some of the bright spots in the restaurant space that you've seen.
Yeah, so we have seen restaurants who have adapted very quickly. The one thing I will say about the takeout and delivery is the vast majority of restaurants that had some sort of takeout operation normally did anywhere between 10 and 20% of their revenue model was based off of takeout. And when their dining rooms were shut down, we saw that very quickly shift to where they were trying to rely on what was normally 10 to 20% of the revenue as their sole revenue source. Restaurants who had a little bit higher revenue percentage at that, you know, say in the 40% range, it was a lot easier for them to transition to that kind of full-time model. And so we saw a lot of restaurants who initially had come on to try the takeout model for the first couple of weeks and realized it wasn't covering their fixed costs. And so they decided to cease that operation and really focus in on, hey, how can I make sure I'm set up to come back as strongly as possible when my dining rooms reopen? And so they did things as, how do I restructure my dining room to make sure that I'm able to fit as many people in there as possible? And they were, you know, probably able to get up to 60 or 70% of what their normal capacity was while still meeting the physical distancing guidelines. People have looked at other areas of the restaurants that they hadn't normally used for whatever reason and have restructured that way as well. And so we've seen all sorts of solutions across the board. A lot of people really relying on technology. So going to maybe order ahead systems, et cetera, so people are able to come in and they're able to turn those tables over faster because you're not doing the food prep while the customer is actually sitting at the table. And that can actually help replace some of that revenue as well. Whereas if your average seating might be an hour and 20 minutes, if you're able to decrease that to 40 or 50 minutes, you're able to sit another seating in there and help replace that revenue. So we've seen a lot of innovative things take place in the restaurant industry, and we're going to continue seeing that. I mean, it's a resilient industry. I will say this 100%, the restaurant industry is the most entrepreneurial industry out there, and we will continue to find solutions.
Great.
Hey, Dan, this is Andy. I just had a quick question, if I could. We had spoke offline on the one size does not fit all, and you gave some great examples of some of the things that certain restaurant categories do versus other restaurant categories. Can you comment a little bit on that?
Yeah, absolutely. A perfect example of the one size doesn't fit all is when we start talking about concerns on customers queuing. You know, so for instance, if I'm going into a fast casual restaurant that has counter ordering, that's going to be a concern for me. But if I'm walking into a fine dining restaurant where we're generally already pretty well separated and there isn't any type of queuing concern, those restaurants are going to have two very different solutions to the same problem, and that's social distancing. And you know, the restaurant industry is not, like you said, Andy, a one-size-fits-all model. So we have everything from our quick service restaurants to fine dining to pop-up restaurants, chef-driven restaurants, et cetera. And so we're all trying to do is provide toolboxes so that these restaurateurs can go in and kind of pick out what is going to work best for them and their business model, and quite frankly also experiment, figure out what works so that other restaurants in their same position can help learn from that as well.
Thanks, Dan. We have some good questions too around, all of these guidelines and recommendations, it feels like restaurants are all doing something a little bit different. Is there anything that's required, or where's the line between guidance and mandate?
Yeah, so here's the requirements. The requirements are social distancing. Now, I say that, but we also talked about how you can put up physical barriers. So I would say what the requirement is social distancing, or in place of social distancing, you have those physical barriers so that the virus itself is not able to be transmitted. So that's probably requirement number one. The second requirement is going to be your sanitation schedules. Now, there's not a specific thing that says you need to be doing, wiping down the doorknobs every 5 minutes, because again, this is going to be dependent on your model. If I'm turning and burning 200 guests through that restaurant every hour, for instance, a casual or fast casual restaurant, I'm probably going to be wiping down those commonly touched surfaces more often than somebody who might be doing 40 guests in the similar size building that might be a little bit more towards the higher end of the dining experience. And then of course there's the masks. And I can't necessarily tell you that it's legally required by the governor's office, but what we have seen is the governor's office is specifically saying you need to implement these protocols, and the CDC, OSHA, and Arizona Department of Health Services are all saying you need to be wearing masks. Now, theoretically, you could get away with that if you have an employee who's not going to be within 6 feet of anybody, but I'm not aware of too many restaurant operations where that's the case. So I think the mask is going to be pretty clear. So I think those are the big ones, making sure we're not having mass groups of people coming in. The other big requirement is if you're a traditional bar, if you will, where you have no food service, they're not allowing those places to reopen. And so there has to be some sort of food offered for these places to reopen. So those are kind of the big categories, is in protecting your employees with the masks and your customers with the masks, and social distancing and sanitation are the big requirements.
Thanks, Dan. We have a few questions that are kind of all getting at the same thing, which is around issues of adoption, compliance, and enforcement. And so there's a question in there around like, well, what if we did surveys to restaurant owners to see if they're actually doing these different things? There's questions around who is truly regulating if these guidelines are being followed or not. Are people getting reported? Are there any consequences? I think some of the people on the call are seeing variety in the restaurants that they're either walking by or dining in, and wondering kind of how is it getting regulated?
Yeah, so the first thing is it's going to be regulated by our customer base. Customers know what they want to see. They want to be dining in a safe environment. So that's going to be the number one regulator, is people are going to be voting with their feet. But behind that, what we talked about before is that the local police departments are going to be the actual legal enforcers of any of this. So we've seen a couple instances of restaurants that have been highlighted in the news lately, and those police departments have gone over and talked to them. Now, I'll tell you, I think that most of those are going to be an education first type thing. But if a restaurant basically is warned about something and keeps it up, I would not doubt that you would see an enforcement action taken by some of those local jurisdictions. Additionally, there are a lot of rules around this that are related to the Arizona Department of Liquor License and Control. And again, I believe that they are going to take an education first approach, so to make sure that we're trying to get everybody into compliance. But there is a possibility that they would come in and suspend your liquor license if those types of activities continue after the education has already taken place.
And have you heard anything about sort of consumer watchdogs or customers or individuals that kind of say, hey, this restaurant isn't abiding, and calling a hotline or calling local police departments, or they just vote with their feet and walk away?
Yeah, absolutely. We've definitely seen customers that are being very proactive in that way as far as trying to call, and we get some of those calls as well from those customers. I'll tell you a large majority of them are related to what I talked about, that they just needed a little bit of education as well. The example I gave was the glove usage. We've gotten a lot of calls on that saying, hey, my server wasn't wearing gloves, what's going on? And once we talk to them about it and say, hey, well, this is actually what the CDC says. We've got scientific studies that back this up. And once they know that, they go, okay, that makes sense. There's others that have called in and said, hey, I don't think I was 6 feet away from the person next to me, et cetera. Some of that's going to be a little bit hard to enforce because it's something that happens right at the moment. But I think if we've heard from a lot of customers, and if they don't feel safe dining in a restaurant, I do not believe that they're going to be returning.
Yeah, and Dan, that's a great point, and I know you addressed this a little bit in your presentation, but it's that consumer confidence that's really important to kind of rebuild. And so thinking through the different ways, there's that education piece that you're talking about for customers in order to give them the confidence that something might be safe. What can restaurants be doing with their layout or with their processes that kind of instill that education and confidence without having to sit down every customer and explain some of these CDC guidelines?
Yeah, so great question. So the first thing I would say is be visible, right? So if you're going to be sanitizing doorknobs, et cetera, do it in a visible manner so that customers see that that's actually taking place. The second thing is you are likely going to have a protocol for your staff to follow. Let customers see that, whether that's posting in the windows or having a table tent on the tables, or if you're using some sort of electronic form of communication, a sports bar type thing, they have the TVs. If you dedicate one of those to just kind of scrolling through, here's all the safety measures that we're taking for customers, and here's why we're doing it. And a lot of them are going to be straightforward. We're going to be sanitizing customer areas after each use. That's straightforward. Customers get that. Hand washing schedule. We're going to be having our servers wash their hands this frequently or between each plate drop. And we're doing it because it's actually safer. It's CDC recommendations over them wearing gloves. And the more ways we have to get information out, the more customers we're going to be able to contact. And the great thing about restaurants is, we all know this, customers talk to each other. That's how people find out about great restaurants, right? Your buddy comes and says, hey, you got to go try this place. That communication's not going to stop in the world of COVID. And so we really get an amplifying effect. So the more customers we're able to reach, they're going to go talk to their friends, and we're going to be able to reach them that way. So the more things we can do. As far as layout goes, the best suggestion I have is customers want to be able to come into a restaurant and get to their seat and not feel like they're being put very close to other groups. And that's going to be completely different for each restaurant. But keeping that in mind, there might be different ways to lay out those restaurants so that your thoroughfares are clear of groups of people as you're trying to seat customers.
Thanks.
Hey, Dan, this is Andy again. I just had a related question that is, I think, important for everybody, and it's around the trust and confidence level. Could you just give us your read right now of where the current trust and confidence level is that you're seeing in the consumer side, and has that changed significantly over the last week or so?
Yeah, absolutely. Well, let me first start off by saying that as we ended 2019, the restaurant industry in the United States was the most trusted industry by consumers. Okay, so we take that very seriously. And COVID is going to put that to the test. And what we saw is, prior to our opening on May 11th, 50% of consumers said they felt comfortable returning to dining rooms immediately. And we had about another 20% that said they were going to feel comfortable within 2 weeks of reopening. So we're talking about 70% of the customer base have already told us, we trust you guys to keep us safe. And what restaurants are going to be doing, what restaurants are doing and will continue to do, is really going to determine on whether that number goes up or goes down. But we're starting off with a very healthy percentage of our customer base that trusts that the restaurants will be able to do things that will keep them safe, so they can go out and dine with their families and friends.
Dan, what about, has there been any indication of how long phase one will be? I know it's based on metrics, and CDC has kind of guidelines of what milestones need to get hit before phase two starts. Do you have any thoughts, kind of can tell the audience kind of what some of those numbers are and what we're seeing relative to those milestones?
Yeah, absolutely. And just as a reminder, everybody, that the gating criteria on that is the number of influenza-like and COVID-like illnesses reported in hospitals. The second measure is a percentage of positive tests to overall testing. And the third one is the ability of hospitals to respond to any uptick in cases without going into a crisis care mode. And we've met all of those for phase one. We have to meet those same criteria to go into phase two. Now, the one thing I will tell you is logic will tell you as people are just interacting more, we're going to see an uptick in cases. So the key metrics there is going to be is our percentage of positive cases to overall tests rising. And if it is, that's going to delay our entrance into phase two. As far as specific timeline goes, it's a 14-day measurement period, but you really have to allow for the reopening to be in place before you can start taking that measurement, because the virus has a 14-day incubation period as well. So from the association standpoint, this is all the governor's decision, and I can't predict what the data is going to say, but if the data, we don't see an uptick in that percent positive, my guess is probably sometime in the middle of the summer, they would be looking at moving into phase two. The one thing I will say, though, is when you look at the difference for restaurants in phase one and phase two, and we don't know exactly what Arizona's phase two is going to look like, but we can look at other states that have published that already. And there's not a huge difference in terms of what restaurants are going to be allowed to do in phase two versus phase one. You know, we think social distancing is still going to be there. We think the mask usage is still going to be there, et cetera. So really, I think what we're telling restaurants to do is plan for this to be in place for a long time, but we're hopeful that we can get out of it a little bit sooner.
Thanks. We have a few questions on kind of what you can require customers to do coming into your restaurant. So there's one, can we take our customers' temperature before they enter the restaurant? Another one is around liability waivers. Can you prevent customers with those types of documents? Are those things legal? Are you seeing restaurants doing them?
Yeah, so I haven't seen restaurants doing them. The legal question is a little bit in the gray area. We don't have very clear guidance on whether you are going to get yourself into trouble if you take a customer's temperature or if you require them to sign a liability waiver. What I can tell you is we don't have any guidance on that from CDC, OSHA, or anything related to the Americans with Disabilities Act. Whereas we do have that protection for us being able to take our employees' temperatures. So I think what we would do is caution restaurants that if they wanted to go down that path, they should probably work with their legal counsel or retain legal counsel and figure out what the traps are going to be. There are going to be ADA instances where, because again, you got to remember the ADA protects most medical conditions, and you don't know if somebody is coming off the street, has a high temperature because of some other underlying medical condition or not. And so you can have some ADA compliance issues there. Additionally, like we talked about before, if you're temping people who are coming off the street in Arizona in summertime, those people are going to have to acclimate before you're able to temp them. And so I think we run into some logistical issues there. But if restaurants are interested in doing that, our advice would be to work with their legal counsel, because there is not guidance on that at any level of government on how we would effectively be able to do that. And what restaurants need to be able to rely on is that guidance. I think any liability protection legislation that comes down from the federal level or the state level is going to be pegged to us following guidance. And if there's no guidance on temping temperature or temping customers or those liability waivers for customers, that liability legislation is probably not going to apply in that situation. Great,
thank you. One last question as we kind of head to the end of the hour is, there's been a lot of, like you said, restaurants are adaptable, entrepreneurial, and there's been a lot of changes, a lot of which have been positive. And so I'm just wondering long term, so I know curbside pickup has become a really popular option for people. I know the takeaway kind of margaritas or beer to go has become really popular with people. And so I'm just wondering, what changes or adaptations do you think maybe are here to stay and are going to impact kind of the restaurant industry long term?
Yeah, so you hit the nail on the head with takeout and delivery. I think that more restaurants are going to invest in those infrastructures. I also think that this has really highlighted some of the inequities, if you will, of the third-party delivery services versus restaurant operators. And so I think that you're going to see a lot of solutions come on board that will address that. You know, a normal third-party delivery service is taking 30% of your ticket price, plus sometimes the delivery fee for that to happen. And I think restaurants before, when they had their dining rooms to really rely on that, that was the price of business. They might have just been breaking even, but they were trying to get into the marketplace. And so I think you'll see more and more market pressure to push those fees lower, or even new solutions to the third-party delivery services. To-go alcohol, consumers love it. Consumers love it. We've got nothing but positive reviews on it. I think when we're talking about alcohol to go for restaurants, that is an in-depth, long-term conversation. I think the good news is we have that through the executive order for the foreseeable future. And so restaurants are going to be able to continue to work out those kinks, et cetera. And then we'll look into the future and see what restaurants are going to want to keep and what restaurants don't think is worthwhile keeping as we try to get back to some sort of semblance of normalcy.
Mm-hmm. Cool. Well, Dan, we're just about at the hour. Any final kind of comments or thoughts for our participants?
First of all, thank you very much for having us and letting us present this information. I would say for all the restaurateurs that are listening, this continues to be a fluid situation. So please, sign up for our updates and utilize us as a resource and the Commerce Authority as a resource. We are not pegging any of our resources to membership during this time, so don't feel like we're trying to pressure you into anything. Everything's available for free on our website, and we're also available for questions. So if you have specific questions for me, feel free to contact me directly, and we can discuss or chat through any specific type of troubles that you might be having. So just know that we are here for anything and everything that restaurants need.
Thanks so much, Dan. Really helpful session, really great information. And to our participants, we'll be back tomorrow with our safety session, Friday, Marketing to Return Stronger. And I'm posting the link again to our business bootcamp in the chat so that you can register for future sessions, including next week's. We've got another great lineup for you. So thank you to everyone for today. I hope you have a great Wednesday.